Hi everyone, my name is Patrice Romano and I will be talking about smoking, alcohol, and substance abuse in Russia and the United States. So first I wanted to touch on why I decided to choose Russia and the US to compare. So when I started doing some research on countries that have substance abuse problems, I found a trend in that the United States and Russia tend to be very similar in the way that they have a high prevalence of substance use disorders and death rates regarding the substance use disorders. So the graph at the top, not the graph, the map at the top left, it is the share of the population with alcohol or drug use disorders. So you could see clearly that Russia and the United States are dark blue. So those show that they have the highest density of alcohol or drug use disorders. And then in the graph in the bottom right, you could see the death rates from the substance abuse disorders. So as you could see again, the trend where the United States and Russia tend to be the darkest. So that's why I decided to pick these two countries to compare. So to get into the demographics of the health issue, scientists have discovered that women who use drugs can have issues related to hormones, menstrual cycle, fertility, pregnancy, breastfeeding, and menopause. So because this is a class on humans' health, we're just going to look into how substance use disorders and alcohol affects the women's health. So the reasons for the drug use among women include controlling weight, fighting exhaustion, coping with pain, and attempts to self-treat mental health problems. And we're going to get more into mental health later because I feel like you can't really talk about substance abuse without speaking on mental health. So compared to men, women typically use substances in smaller amounts of a certain drug and for less time before they become addicted. So another way to put it is women tend to become addicted relatively faster than men. And women also may have more drug cravings and may be more likely to relapse after treatment, according to the NIDA. And then also, sex hormones can make women more sensitive than men to the effects of some drugs. So there are some biological and physiological reasons why women use drugs and may continue to use them. So alcohol in women. I wanted to touch on alcohol briefly because I feel like alcohol is definitely the most used substance in the United States and also Russia. So women experience significantly shorter time intervals between the initial use of alcohol and the onset of an alcohol-related problem. So compared to men, women typically, once they start drinking alcohol, maybe it's binge drinking or making it a habit, it typically becomes a alcohol-related problem quicker than men. And then also, women are more likely to consume alcohol in response to stress and negative emotions. So just daily stressors like childcare, which we'll touch on, and just other stresses that women may go through and negative emotions, they're more likely to consume alcohol to kind of cope with that. And then co-occurring psychiatric disorders are more likely in women with alcohol use disorders. So most likely women that have an alcohol use disorder, it is more likely that they also have a co-occurring psychiatric disorder. So maybe it's depression, they're using it to cope with their depression, anxiety, PTSD, anything like that. And then women are also less likely than men to seek treatment and more likely to face gender-specific treatment barriers. So as I go into examples, childcare responsibilities, women tend to have bigger stressors regarding children. Not all women, obviously, but majority of women, a lot of the childcare responsibilities are placed on them just because of like gender norms and the way things are in America and also in Russia. Transportation, and then financial status, and also the social stigma. So I feel like women we kind of have this pressure on us, I feel like, to always be okay and always be like that rock for people. So that the social stigma that women have that of always needing to pretty much just, like I said, be okay and kind of take the role of like the caregiver, that could lead to an alcohol problem because that's stress. So nicotine in women. Women who smoke are twice as likely as men to have heart attacks. Women experience faster lung deterioration than men, thus are at an increased risk for chronic obstructive pulmonary disease and lung cancer. Smoking may also cause early menopause, increased menstrual bleeding, difficulty becoming pregnant, or spontaneous abortion. And then to get into quitting smoking and substance abuse, women may have more difficulty quitting smoking due to our hormones. And the gonadal steroid hormones may be associated with smoking cessation. So I saw this in multiple articles in regards to trying to quit any substance. A lot of articles were talking about the different phases of the menstrual cycle of women. And as it says in the second bullet, trying to quit during the follicular phase of the period seems to be more successful than women who attempt to quit in the luteal phase. So that is something to think about, how hormones may play a factor in why women tend to have less success quitting smoking compared to men. And then also weight gain plays a big factor in quitting smoking, because typically once one quits smoking, they not all, but most people will notice a weight gain, because nicotine is a stimulant. So when you quit, you might experience weight gain, and that could be hard for women compared to men. It might put more stress on the women, so they are 3 times more likely to relapse, specifically because of the weight gain that comes with quitting the drug. And then to get into mortality and morbidity, from 1999 to 2017, the death rate from drug overdoses among women aged 30 to 64 increased by 260%. There were 18,110 overdose deaths for women alone in 2017. And then the rates of overdose deaths increased for all drug categories examined, but with a notable increase in rates of deaths involving synthetic opioids. Heroin and benzodiazepines. I'm sorry, I don't know how to pronounce that. And then the CDC also reports that cigarette smoking causes more than 480,000 deaths each year in the United States. So in regards to the morbidity, over 16 million Americans are living with a disease caused by cigarette smoking. And then an estimated 2 million people aged 12 or older had an opioid use disorder. And about 130 Americans die every day from an opioid overdose. So like I said before, typically alcohol and nicotine tend to be the go-to substances for Americans, but also opioids, as you know, specifically in the East Coast, we're having an opioid epidemic. So a high percentage of people are actually dying from this opioid abuse. And then as you can see this chart from 2007 and then to 2017, every single category, whether it's prescription opioid, which is like pain pills, synthetic opioids, and then heroin, the rates have just gone up exponentially for drug overdoses. So each person represents a drug overdose per 100,000 women. So this is for women especially in the age groups of 30 to 64. So it's really just astonishing how much it's gone up. So then to get into the US specifically, the US demographics, I found on the World Health Organization website, they took 190 countries and they ranked their overall health system performance. So this is like the healthcare system overall, its general performance on the health of the people of the country. So the US out of 190 ranks 37 in overall health system performance. And the mortality rate in 2017 was 21.7 per 100,000 people in regards to drugs. And then the healthcare system differs compared to advanced industrialized countries. So in the US, I wanted to get into kind of how our healthcare system somewhat fails a lot of people here. So when you're comparing the US to industrialized countries like Germany, France, Italy, Japan, we don't have universal health care. So that could become difficult for women wanting to seek help. So we have, like I said, no uniform health system or a universal health care coverage. So that makes attaining mental health services very difficult, and it puts vulnerable populations like women at a disadvantage. So because women also end up paying higher premiums compared to men, it could make attaining mental health services, if you feel like you might have depression or anxiety or just struggling in general, it may make getting help and seeking out some kind of psychological help difficult, which then can make substance use coping go up. So because we don't have universal health care coverage and it makes a lot of services more difficult to attain, this could lead to substance problems, especially for women, because we tend to use substances to cope with our stressors. So not being able to pay for our health care is obviously a big stressor. And then according to this article that I found, over 1/3 of women report skipping needed medical care because of high costs. And 11 million women still have no insurance coverage, and that was recorded in 2018. So that becomes a big problem when you talk about substance abuse, because if over 1/3 of women report skipping needed medical care because of high costs, it is highly possible that they turn to drugs, whether it's alcohol, maybe marijuana, to try to cope with these issues. And then this figure right here is the national drug overdose deaths, and it started in 1999, 2017. So you could see every year the total overdose deaths for male and females it just goes up every year. Rarely is there a year I really don't think I see a year where it actually goes down. It looks like from 2008 to 2009 it's relatively similar, but besides those 2 years it goes up. So the line in the orange, that is for women. And now the Russia demographics. Russia, out of 190, ranks 130 in overall health care system performance, according to the World Health Organization. And then overdose mortality rates is 10.2 per every 100,000 persons, 700,000 alcohol-related deaths annually. So also, when I was deciding on picking Russia to compare to, I feel like a lot of people, Americans, I don't know if it's ignorance or I don't know, a lot of times when we think of Russia, we think of vodka, we think of alcohol problems. So I especially thought of Russia when thinking about substance abuse. But also, while doing more research, I actually found out that Russia is currently facing an illicit drug use problem. So typically when we think of Russia, we think of alcohol use, but lately they've actually been having illicit or illegal drug use problems. And that's something that we'll touch on later. But it seems to be an epidemic that the healthcare system interventions, they're not prepared for. So the morbidity is 2.2 million alcoholics, 160,000 diagnosed with psychosis annually. And then some researchers in Russia actually estimate there are 4 to 6 million regular users of illicit drugs. And then the lifetime prevalence of illicit drug use is up to 40% in Russia right now. And then, like I just mentioned, the healthcare system seems to be unprepared for interventions, and addiction in Russia is still treated as a medical problem. So that becomes an issue because they might not have, in Russia, it seems like from the research that I looked at, it seems that they don't really have specialists available. So they don't have the psychologists, the substance abuse counselors, the therapists. So it seems that they still, if you have a substance abuse problem, you go to a hospital and it's just treated as if any other medical problem. It's not really treated as a psychological problem. And I feel like when you don't look at the psychological issues that come with substance abuse, you're not really fixing the problem. Because in my opinion, you can't really talk about substance abuse without talking about psychological problems. And like I just said in the second bullet, social workers or psychologists specializing in long-term programs do not exist. So according to the research, it's seen that they had a couple inpatient programs, but they just were very short term, and it was just kind of like you stay at the hospital in detox, but then after that you're just out on your own again. So they didn't have many outpatient programs like we have here in America. Even though our healthcare system isn't amazing, we have many actual outpatient programs that people with substance abuse problems can attend. And then some social and societal factors for substance abuse and overdose. So it seems that from the research, people are reluctant to seek medical help due to general distrust of the medical institutions. And this is as a result of mistreatment, fear of police, and perceived ineffectiveness. And then also, the drug users, fear of police and the police's fear of users may contribute to the mortality. So in this study, they were telling a story about this person that was overdosing on heroin. So it was with a intravenous drug. And the person was overdosing, and the cop did not want to give him mouth to mouth because he thought he had HIV. So this becomes a problem because if the cop is reluctant to give this person mouth to mouth because of HIV, I'm sorry, excuse me, that becomes a big problem. The police are not educated on HIV, obviously. And this just becomes obviously a big barrier to for people to get help. And then the risk of overdose is heightened because of insufficient emergency response infrastructure, insufficient cardiopulmonary or naloxone training, and the reluctance to use non-abstinence-based treatments. And then cultural similarities and differences among women. Expectations for women's bodies can lead to drug abuse, like cigarettes and cocaine, as a form of weight management. So as I touched on a little bit before, cigarettes and cocaine tend to help manage weight. So I can't really speak much for Russia, but I know here in the US, I'm sorry, excuse me. I know here in the US, we have harsh standards for bodies. Social media does not really help this issue. So a lot of times women may turn to drugs to help manage their weight. And once they try to maybe quit the drug and the weight gain comes on, it occurs, it doesn't help the relapse. And then rape culture puts women at a disproportionate risk for substance use coping. And then also gender roles and gender norms of women may deter them from getting help. So in regarding the second bullet with rape culture, I read in this article how women, if they don't really have healthy coping systems, or if they don't maybe have access to proper health care or psychological help, a lot of times women turn to substances for coping. So because of the rape culture, I also read in multiple articles with Russia, rape culture is pretty similar to how it is here in America. Women typically live in fear somewhat. So because women tend to use drugs as a way of coping with pain and emotional, and their emotional needs or whatever, this puts them at a very high risk for substance use coping. And then also gender roles and gender norms of women may deter them from getting help. Like I said before, women feeling like they need to always be okay, and that's a big deterrent. And then Russia does not offer any harm reduction programs. So harm reduction programs such as safe needle injection site facilities, needle exchanges, or Narcan distribution. So here in America, I know as long as you have a prescription from a physician, you can get Narcan. So that is if you're having a opioid overdose, you can just put that, I believe it's up in the nasal passages. It pretty much restarts your heart, and it pretty much brings you back to life. So in Russia, they don't have that. And then also, 54.5% of Russian narcologists list religion as the most suitable therapy for drug addiction. And then also, drug addiction disorders are typically treated with antipsychotic drugs, such as drugs that are helped to treat schizophrenia instead of agonist and antagonist agents. So that becomes a big problem regarding substance abuse. And then cases of rape are not usually reported in the Russian Federation. So I read in this article, it was written by a woman in Russia. Women report that sexual harassment in the workplace is so common that it's almost considered as the norm. And then the notion that violence against women is a private matter also hurts and may help aid in women using substances to cope. And then the percentage of women in the legislative and executive bodies in Russia is very low. So with not a lot of women in the government, women are at a disadvantage. And then also by law, women get maternity benefits, but as said in the article, it is usually violated by employers. And then some ethical considerations and actions to consider. Then SAMHSA National Helpline, it is free, confidential, 24/7, 365 days a year. And it's a treatment, they refer you to treatments and information services for individuals and families facing mental health and substance use disorders. And this service is also in English and Spanish. And then because of the Affordable Care Act, most women in the U.S. have guaranteed access to health coverage, and then more than 7 million working-age women have gained insurance, and millions now receive additional benefits and cost protections. And then also, with funding primarily from state and local governments and the support of the North American Syringe Exchange Network, there are now approximately 200 programs for syringe exchanges in the U.S. So those are harm reduction programs, which helps lessen the overdose rates. And then also, Russia's government now provides a more extensive treatment plans for substance abuse disorders, and they are provided by taxes. So there are specialized treatment services for patients with drug use disorders, including IDU, so intravenous drug users with HIV and AIDS. And then they have inpatient and outpatient detox and rehab services now. And so now my summary is there are biological, physiological, and sociocultural conditions that may make women abuse drugs differently than men. And then women are less likely than men to seek treatment due to gender-specific barriers. Compared to other industrialized, high-income countries, the U.S. is lacking in its healthcare system, and this disproportionately affects women. And this also creates barriers to receiving mental health or addiction services. Illicit drug use is on the rise in Russia, and the healthcare system seems to be unprepared for the intervention. As illicit drugs are getting more popularity there in Russia, the healthcare system is not used to that, and they seem to be unprepared and not fully educated. And they still treat substance abuse as a medical problem, which becomes a problem in the future. And then they are reluctant to seek medical help due to the general distrust of the medical institutions. So if the people that have the problems themselves are reluctant to get help, that just worsens the problem. And then the inequality of women is similar between the countries, but in my opinion, the governments view addiction differently. So like in America, even though our healthcare system isn't amazing, I don't think we really view substance abuse as a medical problem. I think we see it more as a psychological problem and a true disease. And then substance abuse is not prioritized in either governments, in my opinion. I know here in America, I think we could do a lot more to help the opioid epidemic and just overall substance abuse. And in Russia, from the research, it seems that they're not really prioritizing or taking seriously the substance abuse problems. And yeah, these are my references, and that's all. Thank you.